Hello, I'm Caleb Anderson, Doctor of Physical Therapy with Midwest Physical Therapy. I'm going to show you how to do a proper squat. So for people with knee, hip, or low back pain, it's very important that you strengthen your glutes and your quadricep muscles so that you stay strong and don't develop imbalances in your body that can lead to further injury. So we have a pull right here. This is to keep the spine in alignment so you don't do excessive forward bending. When you do excessive forward bending, it can lead to back injury, especially discogenic injuries. So Mike is going to turn and face this way. What he's going to do is bring the pull behind his back. He's going to keep it in contact with his head, his mid-back, and just his low back, and then kind of his sacrum. So if the pull comes off of contact at any of these points, we know that the spine is bending forward. Especially with any forward bending movement with axial compression from gravity, it's not a good thing for your back or your spine. So what Mike's first going to do here, keeping that in contact, he's going to bend forward, do a little hip hinge, so just the hips moving, and then he's going to bring in his knee bend after that, and then he's going to bend his knees up and then straighten with the hips. So he kept good alignment there, and again, the real important thing with a squat is that you get that hip hinge. If you're not hinging your hips and getting your chest forward, you're not activating your glutes, and that's very important muscles for anybody with like an anterior pelvic tilt or a plethora of other injuries. So now we're going to do it a little bit faster so it's not so robotic. So he's going to do the hip hinge with the knee bend and getting his chest out forward. Then he comes back up and really squeezes his glutes on the way up. So we'll take the pull out when somebody's feeling more comfortable and doesn't need that tactile cue to keep them in alignment. And I'll bring his hands forward, and I'll go ahead and hip hinge and bend the knees at the same time, keeping that lordotic curve in his low back and up. So that's an appropriate and proper squat that's not going to put excessive strain on your low back. For more injury prevention tips, visit us at midwpt.com or follow us on Facebook or Instagram. Thank you.